Two conflicting storylines tonight on the fight against coronavirus. First, new cases and hospitalization rates down dramatically last month. That's a good sign after January also became the deadliest month of the pandemic. States and major metro areas like New York, Chicago, and LA County loosening restaurant regulations as a result. But this comes as a second story is unfolding involving those more virulent COVID strains first seen in the UK, South Africa, and Brazil. CDC says at least 471 cases in 32 states have so far been detected. A short time ago on CNN, Dr. Anthony Fauci said there's a high rate of reinfection with the strain from South Africa if it becomes dominant. Calls now for the administration to prioritize getting more first doses to people. That includes Michael Osterholm, a top epidemiologist at the University of Minnesota and a former medical advisor to President Biden's transition team. On Sunday, Osterholm used the metaphor of a hurricane to make his point.
Imagine where we're at, Chuck, right now. You and I are sitting on this beach where it's 70 degrees, perfectly blue skies, gentle breeze. But I see that Hurricane 5, Category 5 or higher, 450 miles offshore. And, you know, telling people to evacuate on that nice blue sky day is going to be hard. But I can also tell you that hurricane's coming.
Well, today, the Biden administration indicated it would stick to the two-dose schedule. I want to get perspective now from our chief medical correspondent, Dr. Sanjay Gupta, and Dr. Alina Wen, a former Baltimore health commissioner and CNN medical analyst. Sanjay, there was obviously so much hope when the vaccine started rolling out. Now, with all these variants, that hope is certainly, if it's not fading, it's certainly, more cloudy. Should it be? Because experts say it could be a long time before we get back to a real sense of normalcy.
Yeah, well, I think this has added a lot more urgency to an already very urgent situation, Anderson. The bad news first. First of all, people who've been infected by this coronavirus and have their own antibodies, there's now increasing evidence that those antibodies may not be as effective against the variants. So the chance of reinfection, as you mentioned, becomes higher as a result. There's a lot of people out there who said, I had it, I'm done with this. That may not be the case if these variants start to become more and more dominant. Second thing is that the vaccines that are out there, like the Johnson & Johnson data, we know that while they're effective across the board, they are less effective against the variants as well. The good news is that, like with, again, the Johnson & Johnson one, they were still effective against people getting really sick, whether it was the variant or the other, the existing circulating coronavirus. It was pretty effective against people getting very sick, being hospitalized, or dying. So what this really means is we've got to get people vaccinated, and quickly. That's the best chance of basically protecting them and and slowing down the rate of transmission of these variants.
So does that mean, Sanjay, you think rather than holding, half of the doses to give people a second dose so that there's guaranteed to give people a second dose, that they should kind of flood the market with first doses?
I kind of do, and I realize this is a provocative point and people have gone back and forth on this. I know that the CDC is not yet recommending this, but let me show you a couple pieces of data here. The Moderna trial, we looked at this data pretty carefully, trying to get a sense of just how effective is the first dose and then how much more effective when you add in the second dose. If we show the numbers there, 80.2% after the first shot. Now, the caveat is that they only studied that for a few weeks, right? Because these people then got a second dose 3 or 4 weeks later, depending on which vaccine. So it's small data and it's short-term data, but it did look promising. Let me show you Pfizer really quickly here. This graph, I want to explain this to you because we dug into this when we saw the Pfizer apply for the emergency use authorization. Busy graphic, but bottom line is this, the blue line going straight up to the upper right corner, that's placebo group, people who just got the placebo. The red line is the number of people who got sick after the first dose. And you can see that line just really flattened out. And that's after the first dose. So it's pretty clear there is a benefit to the first dose. Anderson, people need both doses. We got to do this right, but we should give people the doses right now, not hold doses back, and then promise them they'll get their second dose. We are in the middle of a public health emergency here. So this idea of holding doses back, I think, just doesn't make a lot of sense. But we should also guarantee them within 6 weeks, as the CDC says, they should be able to get their second dose.
Well, Dr. Wen, can that guarantee be made? Are there enough doses out there? And do you agree with Sanjay on this?
Well, I think the guaranteed timely second dose is really critical. And I think that what the Biden team is saying is to the providers, don't hold back the second dose. We are going to guarantee that there's going to be a steady supply. So if you are holding back on half of your supply because you think that we're not going to give you a second dose, then go ahead and give that dose now to people who have not gotten anything at all. We'll guarantee that in several weeks' time, you're going to get that second dose. So I think that is reasonable. But I will just say that the timely second dose is so important because that's how these Pfizer and Moderna vaccines were studied. By the way, this is different from Johnson & Johnson, which is studying a 1-dose versus a 2-dose regimen. So in that case, you could actually have the data and make a reasonable assumption to say, if you have a 1-dose vaccine, it's going to be this effective. A 2-dose vaccine is somehow less effective, but it's worth getting it to more people in order to do that. But I really fear that if we don't give that timely second dose, we could be seriously eroding public confidence. Already, there are a lot of people who think that we have expedited the vaccine approval and are not following the science. Well, we need to be following the science to the letter here, or else we could really erode public trust.
Sanjay, Dr. Nguyen, I appreciate it. Thank you.